Hello and welcome to Edukemy's YouTube channel. My name is Harsh Singh, and in this video we shall cover the government schemes in health sector. We have chosen 10 specific health schemes which are very important and relevant for the health development of the community in India. And these are all relevant schemes, and therefore we will cover them in 2 videos. This is the first video. We will cover 6 important schemes here. Now these all 6 schemes are a part of Ministry of Health and Family Welfare. So this is the agency, Ministry of Family and Health. Now, these 6 schemes I will divide in 2 components so that you understand, and it's very easy for you to remember. So a quick summary here. The first level is the one where we are talking of institutional and infrastructure development. And the second one is for intervention. So all of them are I's. Now, in the first component, we are talking about Ayushman Bharat. Ayushman means long life. We are talking of longevity of Bharat, right? So under this, there are 2 particular schemes. Ayushman Bharat, it was released in the year 2018. It has been 3 years since we started this scheme, and under this there are 2 programs, 2 important programs. One is the program for the health and wellness centers, and the second one is Prime Minister Pradhan Mantri Jan Arogya Yojana. So Jan Arogya Yojana, Arogya means overall wellness. So Jan Arogya Yojana is an insurance scheme for the whole family, especially for vulnerable sections. And health and wellness center is the formation of infrastructure capacity for primary health addressing, right? So this largely addresses the outpatient department in case people have small issues, diagnostic issues, want to consult doctor for a small thing, and in case they want to stay back in the hospital, they have major issues, the whole expenses will be covered up to 5 lakh rupees. So these are the 2 important schemes, institutional and infrastructure development. Yeah. And the second one is the direct intervention. So here, this is easy for you to remember. That's the way I will understand. And the second one is about the government scheme for individual intervention. So here we are talking of National Health Mission. This was initiated in the year 2013, and it has 2 components. One is rural component and the second one is urban. The urban itself was again instituted in the year 2013 and the rural in the year 2005. Why? Primarily because this is the National Rural Health Mission, right? Subsumed under National Health Mission. This was instituted in 2005 specifically because rural India deserves more care, more treatment, health treatment. Also, vulnerable population exists there and private facilities are very less. So that is how it started with rural. Then they realized that we should have get expanded to the whole country. So National Health Mission came, and then it had 2 components. This is what we are going to quickly study. Now, Ayushman Bharat, we are talking of long live India. What is the main idea? Poor population does not have to spend. So one important objective of the scheme is to ensure that we reduce the out-of-pocket expenditure for the people, right? This is one. And the second one is by doing this, we will have the universal health coverage for all the Indians, right? So these are the 2 main important components. All the other schemes, smaller schemes, either have become a part of these schemes or they follow after the initiation of these schemes. So this is how this program is. The first component of this is the Health and Wellness Center. Now, government had already formed under the 5-year plans institutions, infrastructure institutions. So we are talking of sub-center, then we are talking of primary health center, community health center, and then we have the district hospitals and super specialty hospitals. So this was the scheme. If a person's problem is not getting solved through the sub-center, they go to primary health center. If not primary health center, they go to community health center. Or if the issue is so big, they can directly raise it to a district hospital or a super specialty hospital, right? So this is how the treatment level initiates. At the smaller places, primary health center and sub-centers, the infrastructure is less. The doctors are few. There are fewer assisting people also in these type of organizations, right? So they serve a limited area, whereas district hospital will be serving a huge population, right? Very easy to understand. What government has done, also one more distinction here is that these initial 2 levels, the people generally go for small referrals. They go for either getting referred to a bigger hospital or they go for simpler diagnostics. Why is there a fever? They go and consult the doctor. So smaller treatments, and this is outpatient largely, right? Because inpatient facility will be hardly there. But the specialized hospitals are also for inpatient. Inpatient means if somebody has to go through a surgery, they have to stay back. If somebody has got some bigger fracture or accident, they might have to stay back. So these kind of things will be covered under inpatient department, and this is where insurance plans also come into their important role. So we are not talking of insurance plans at primary level. Primary level, people go and return back. So the first part, the government has tried that these sub-centers and primary health centers, many of them be converted into model places, model health and wellness centers. Government is planning to have 1.5 lakh of these health and wellness centers. See, this is how it looks. So people go there for primary health checkups or consulting the doctor. So they will be getting free essential drugs and diagnostic services. So very good provision for all the people who go to these health and wellness center. This is the main agenda here, right? Also, if one is a corporate body, they can adopt this particular center and they can provide all the finances for this place. So this is how it is working. Now, this primarily was formed for rural areas, and there later it expanded to other places also. So in rural areas, one important thing that was hurting was the communicable diseases. This is where it started. But later, non-communicable diseases also, treatment also started to be managed here. So what are communicable diseases? Those which communicate from one person to another. Very simple, corona. So we are talking of kind of viruses, flu kind of diseases. Now, we also must talk about non-communicable diseases, lifestyle diseases, for example, obesity. Some people have got this issue of hypertension, blood pressure. So these are the kind of issues which are non-communicable. However, one can go for the free diagnostic and treatment drugs available at health and wellness center. So this is one. The second component of it is Jan Arogya Yojana. So Jan means people, Arogya means overall wellness, and Yojana is the scheme. Which is the ministry? Ministry of Health and Family Welfare. Earlier, this scheme was known as National Health Protection Scheme. So later, this was renamed into Pradhan Mantri Jan Arogya Yojana and subsumed under what scheme? It was later subsumed under the umbrella flagship mission of the government, which is called as Ayushman Bharat, right? So these were the two components. Now here, earlier the plan was to cover maximum 3 lakh of insurance for a family, and now it is 5 lakh rupees for a family. So inpatient treatment, that means secondary and tertiary care of that particular patient or their family, that can happen, and maximum amount government will pay for them is rupees 5 lakh per annum per family. So this is very important. How are the people getting selected? The government is selecting the people who should receive this treatment on the basis of socio-economic census. So we are talking of 2011 census here. And on the basis of this, 10 crore families have been selected. 10 crore families means around 50 crore people. So this is around 40+% population of the country whose health insurance government has ensured 5 lakh rupees per annum per family. So what is the objective? Providing comprehensive health insurance to all vulnerable population of the country. This is the objective. This is the ministry and certain several components of the scheme. So, for example, there is no cap on the family size. Even if members are more than 5, it is fine. But maximum coverage is 5 lakh rupee. Also, all the people who have got diseases before the scheme started, they also will be covered. So we are covering pre-existing disease conditions also. Also, transportation will be given to all the people. Very good. And then government has also created a cadre. Cadre means a specialized service of people who are going to help in this. So we are calling them Pradhan Mantri Arogya Mitra, PM Arogya Mitra. So if a question comes in exam asking which part of the government program does have Arogya Mitra, you're going to talk about Arogya Yojana, right? So this is it. The health mission. Now we are going to talk about the National Health Mission, which has two components. One is the rural component and other one is urban component. Now, in rural areas, there is a very diverse kind of population. So we are talking of small children. We are also talking of pregnant females, pregnant ladies, and then we are talking of old age people, and we are talking of the juveniles. That means adolescent people. Now, all of them have varied and different health needs. That's true. And therefore, government has created a cadre of people to help them. What are we talking of? We are talking of ASHA workers. Now, ASHA workers were a part of the National Rural Health Mission. So 2005, this is when they got institutionalized, ASHA workers. Then we have assisted nursing midwives. They are a part of the community health centers, sub centers. So I will just get into what they do. but they are integral part of the government agencies. And the third one is Anganwadi workers. So who are these people? Anganwadi workers, they work in the ICDS program, Integrated Child Development Scheme program. This was initiated in the year 1975. The basic idea was to ensure that at Anganwadi centers, where these small children come to stay for a while, the ladies here, the Anganwadi workers, would take care of their health needs, some basic education needs, and counsel the females, their parents. So Anganwadi workers are covered. Who are the Asha workers? So these are the community health activists. They go from one home to other and they try to help people understand what are the basic problems which are causing health issues in their families. The third one is assisted nursing midwife. Now she is an expert. This person is an expert, and this person helps like a midwife does during the labor. That means while the lady is giving birth to child, they also help in various other kind of issues in rural areas. Now these are the people. A&M also guide Asha workers. They also guide the Anganwadi workers. So this is the whole scheme, right? Now we will quickly understand the National Health Mission here. Simple and very simple aim and objective of this mission is access, 1, make it affordable, 2, and 3, make it qualitative. So these are the 3 important components: accessible to people, affordable, and qualitative, right? So these are the 3 important components of National Health Mission, and providing, of course, health services, because we are talking of health. And it has also got certain key objectives. So objective, for example, having the MMR, maternal mortality ratio, less than 1 in 1,000 live births. So we are usually, it is calculated in per lakh. So it is around 130 right now for the country, 130 of deaths per 1 lakh births. So this has been converted to per 1,000. Similarly, it goes for the infant mortality ratio as well, and total fertility rate to be maximum 2.1. These are the main aims of this particular mission, National Health Mission, and they have to be executed in both rural and urban areas. Here, the main idea is to ensure that anemia be reduced in the age bracket of females who have achieved puberty and who have not achieved the menopause. So we are talking of the age bracket 15 to 49. Not only that, we also have to prevent the communicable and non-communicable diseases amongst these population, right? So these are the important components. Not only that, the government has also tried to focus on the vector-borne diseases. So we are talking of dengue, we're talking of diseases like malaria, Kala Azar. All these diseases have to be eliminated, and these are part of National Health Mission, right? So again, reducing the out-of-pocket expenditure of the individual, right? So these are the important components of this. Now, the rural component. The rural component is assisted by the rural infrastructure. So we just spoke of the A&M, we spoke of Anganwadi workers, we also spoke of the Asha workers. They are the main people who are going to help. So the same objective in rural areas, the same objective, that means accessible, affordable, and quality treatment in rural areas, especially for vulnerable groups. This is the objective, and to cover places with population less than 50,000. These are the important components. Now, accredited social health activists, Asha workers, and then we have 2 important components. We will discuss them in the schemes related to women and child. They are Janani Suraksha Yojana and Janani Sishu Suraksha Yojana, right? Karyakram. So both of them, what are they doing? They're trying to ensure that mortality while the female labor is going on, that does not happen. Institutional deliveries happen. So for that, the government is also giving some finances in case institutional deliveries happen. Not only that, government is also giving some amount for people to transport themselves to the hospitals and for free health checkups. So these are the important components. Also, Rashtriya Bal Swasthya Karyakram. This is for the small children who are under the age of 18, and their disease diagnostics, early interventions can be given in case they have some issues, some defects, some problems that can be amended. So we will study them in issues related to child and women again. So these are the health issues. So moving ahead, about the urban areas, government started this scheme in 2013, as I just explained. Why? Because it felt the need in urban areas also this is required. So they started Urban Primary Health Center, Urban Community Health Center. Now it becomes very much relatable. And we also will have these A&Ms here also, institutional deliveries. We also will have the Asha workers here also. And the same objective, the same goal, to have it accessible for all the people in urban areas. So this is how the universal health coverage increases. This is how out-of-pocket expenditure for the vulnerable section, it decreases. So these are the 6 themes that we just studied in the health domain. There are 4 more important schemes we'll cover in the next video. Thanks for watching. If you like this video, do shower some love on us through likes, comments, and shares. If you subscribe to the channel, you will receive timely updates. Thanks for watching.